Well, good afternoon, everyone. I'm here with Illinois Department of Public Health Director Dr. Ngozi Ezike and Dr. Emily Landon, the Executive Director of Infection Prevention and Control at the University of Chicago Medicine. We're all here to provide you with an important update on Illinois' progress in protecting our hospital bed availability, supporting our healthcare workers, and keeping schools and businesses open. In many ways, the last 5 months have been some of the most frustrating days of the pandemic for healthcare professionals, for working parents, for vaccinated residents, and for all Illinoisans who never asked for and never deserved the challenges of the present moment. But throughout every minute of this deadly global pandemic, the people of Illinois have demonstrated a willingness to look out for one another and to rise above the loud minority of voices who have used this emergency to naysay, bicker, polarize, and divide. Last August, in the face of a growing threat from the Delta variant, most Illinoisans put their masks back on in response. And as a result, we ended 2021 with fewer COVID-19 hospitalizations per capita than anywhere else in the Midwest. More Illinoisans have gotten a COVID-19 shot than anywhere else in the Midwest. More of our kids are fully vaccinated than anywhere in the region. Nearly 80% of our eligible seniors are boosted. Vaccines work. Masks work. Throughout this pandemic, we've deployed the tools available to us as needed. We've used masks more when infections are raging and hospitals are stretched thin. We've used masks less when spread is diminished and hospitals have enough bandwidth. Our approach has saved lives and kept our economy open and growing. Today, 3 weeks past the peak, and thanks to the precautions our residents have taken, from Chicago to Carbondale, the heightened emergency of Omicron has been consistently subsiding. We are now seeing the fastest rate of decline in our COVID-19 hospitalization metrics since the pandemic began. Our daily total of COVID patients in the hospital has fallen from over 7,300 to about 2,500 today, a 66% drop. The daily total of COVID patients requiring ICU care has also seen a 63% drop. We now have 20% of our ICU beds available statewide, up from a low of just under 8% only 4 weeks ago. Vaccines work. Masks work. And as a result of them and the tremendous commitment of our state's residents, we are on track to come out on the other side of this latest COVID storm in better shape than even the doctors expected. If these trends continue, and we expect them to, then on Monday, February 28th, we will lift the indoor mask requirement for the state of Illinois. I want to be clear, many local jurisdictions, many businesses and organizations have their own mask requirements and other mitigations that must be respected. Having stricter mitigations than the state requirements is something that must be adhered to. Doing what's right in your private business or for your local communities is encouraged. Whether you're a business, a township, a venue, a place of worship, or a city, to name just a few examples, protecting your patrons and visitors is no doubt a high priority. Masks continue to be a very effective way to keep your establishment from experiencing an outbreak or spreading the disease. The lifting of the state mask requirement should not invite people not wearing masks to dissuade those who choose to wear masks. Remember that whether we remove masks or not, COVID-19 has not gone away. There are so many Illinoisans who need to protect themselves from the virus more than others, and many more of us who gladly put on our masks, not so much for ourselves, but for our elderly neighbor, for our immunocompromised aunt, for the toddlers for whom there is not yet a vaccine, for adults who are medically unable to be vaccinated, for the person in the room whose circumstance they do not know. Compassion and kindness toward each other is the hallmark of being an Illinoisan. It's who we are, and whether you're wearing a mask or not, everyone deserves to protect themselves and their communities in whatever way they need to. Masks or not, the best way to stay safe is to get boosted if you've already been vaccinated, or get your first or second shot if you haven't yet. Right now, 2.9 million Illinoisans are eligible to get a booster shot, but haven't gotten around to it. If that's someone you know, reach out and encourage them to take that next step. And of course, it's never too late to start the vaccination conversation with someone you love. Yesterday, approximately 7,000 Illinoisans got the COVID-19 vaccine for the very first time. Find a vaccine location near you at vaccines.gov. I also want to take a moment to address our schools. In-person learning in a healthy environment is what's best for our children. School outbreaks impact hundreds, even thousands of people across a community. And there are a whole lot more infections when districts are maskless. Schools are unlike most other environments. There are far lower vaccination rates for school-age children than adults, higher exposure to on a daily basis to younger children who aren't yet vaccine eligible, and more difficulty maintaining distance in hallways and gyms and classrooms. The equation for schools just looks different right now than it does for the general population. Schools need a little more time for community infection rates to drop, for our youngest learners to become vaccine eligible, and for more parents to get their kids vaccinated. The protocols and tools that we've been using thus far have worked to keep schools open, and they've done it because we have masks and testing and vaccines. Remember that our goal is to maintain a healthy in-person learning environment for kids, teachers, and staff, and to protect all parents and grandparents who interact with our schools, and to avoid adaptive pauses and remote learning. Schools are open and should remain open. Protecting everyone in a school community, their education and their health, is our highest priority. In the coming weeks, it's my hope and expectation that we will continue making
Good afternoon and happy Wednesday. As we all know, we are now into year 3 with COVID, and it has been a roller coaster ride that no one asked to get on. But through all of your efforts, we have reached a point where we can take another step towards getting back to life before the pandemic. While masks will no longer be required in most indoor locations beginning Monday, February 28th, I want to be clear that they are still highly recommended. There are places where, in fact, the mask is still required. The federal government still requires it in transportation, airplanes, trains, buses, subways, and masks are still required inside federal buildings in areas of substantial or high community transmission. Additionally, the Centers for Medicare and Medicaid Services continues to require visitors to long-term care facilities, such as nursing homes, to wear a mask when in the communal area of the facility. Masks offer a layer of protection, and for people who have an underlying condition or who are around people who do have that condition, or for those who are around children who are too young to be vaccinated, you absolutely may choose to continue wearing a mask. Similarly, if you find yourself in a crowded indoor setting, a mask will continue to help protect you. We will continue to recommend masks. As we move forward in a world where we will coexist with COVID, there are tools, there are masks that will help protect us and help prevent our healthcare system from being overwhelmed. Of course, we have an even stronger tool than the mask, and that's our vaccinations, including the boosters. And that is our very best tool for preventing severe illness, and we will continue to encourage people to stay up to date on their vaccines. We are still seeing, of all the people in the hospital with COVID, that 89% are unvaccinated. Another tool that we have include the therapeutics. We have oral antivirals, we have the monoclonal antibodies, and these medicines, which have come from the federal government, are absolutely in limited supplies, but people who test positive and are at severe risk of illness should talk with their healthcare provider as soon as possible about using these possible treatments. Our future, our new normal, if you will, is going to look different. And yes, we may see additional surges, there may still be additional variants, but there are still things that we can do to help reduce our risk. One example that we need to continue talking about is improving indoor air quality. Schools, workplaces, businesses, any indoor location should look at what upgrades can be made to their ventilation systems to reduce the infectious particles in the air. This might even apply to your home, where you can purchase maybe a portable air cleaner with a HEPA filter. Your actions that you've already taken have helped to reduce the amount of virus circulating, and it absolutely has saved lives. But be clear that COVID is not gone, and it won't be gone on February 28th. So we're going to continue to find ways to live with the virus. Our path forward includes keeping these tools that we've been talking about close, and that's the masks and the vaccines, testing, creating safer settings through better ventilation. We can do all these things, and we can coexist with COVID. Now I'll repeat the remarks in Spanish. Buenas tardes y feliz miércoles. Los últimos 2 años han sido un paseo en la montaña rusa, pero gracias a todos sus esfuerzos hemos llegado a un punto en el que podemos dar un paso más para volver a la vida de antes de la pandemia. Aunque a partir del lunes, el 28 de febrero, ya no serán requeridas las máscaras en todos los lugares interiores, se siguen recomendando. Sin embargo, el gobierno federal todavía requiere máscaras en los transportes públicos como aviones, trenes, metros y autobuses. Y todavía se requieren máscaras dentro de los edificios federales en áreas de transmisión comunitaria sustancial o alta. Además, los centros de servicios de Medicare y Medicaid continúan requiriendo que los visitantes de los centros de atención a largo plazo, como las residencias de ancianos, usen una máscara cuando estén en un área común del centro. Las máscaras ofrecen una capa de protección, y para las personas que tienen una condición de salud subyacente o que están cerca de personas que la tienen, o para los que están cerca de niños demasiado pequeños para ser vacunadas, es posible que quieran seguir usando una máscara. Del mismo modo, si se encuentra en un lugar interior lleno de gente, una máscara puede ayudarlo a protegerse. Seguiremos recomendando el uso de máscaras. A medida que avanzamos en un mundo en el que coexistiremos con el COVID, existen herramientas como las máscaras que nos ayudarán a protegernos y a evitar que nuestro sistema de atención médica se vea abrumado. La vacunación, incluidos los refuerzos, sigue siendo nuestra mejor herramienta para prevenir enfermedades graves, y continuaremos animando a las personas a mantener al día con sus vacunas. Todavía estamos viendo alrededor del 89% de todas las hospitalizaciones por COVID-19 entre personas que no están vacunadas. Otras herramientas que tenemos para avanzar incluyen las terapias antivirales orales y anticuerpos monoclonales. Estos medicamentos del gobierno federal tienen un suministro muy limitado en este momento, pero las personas que dan positivo y corren el riesgo de sufrir una enfermedad muy grave deben hablar con su proveedor de atención médica sobre estos posibles tratamientos. Nuestro futuro, nuestra nueva normalidad, se verá diferente y puede que veamos nuevas oleadas y variantes, pero hay cosas que podemos hacer para ayudar a reducirlas. Un ejemplo es mejorar nuestra calidad del aire interior. Las escuelas, los lugares de trabajo, las empresas o otros lugares interiores deben considerar la actualización o mejoramiento de sus sistemas de ventilación para reducir las partículas infecciosas en el aire. Esto puede aplicarse incluso a su propio caso, usando un purificador de aire con un filtro HEPA. Sus acciones han ayudado a reducir la cantidad de virus que circula, lo que realmente ha salvado vidas. Pero el COVID no se ha ido, por lo que debemos encontrar maneras de sobrevivir con el virus. Nuestro camino por seguir incluye mantener nuestras herramientas a la mano, máscaras, vacunas, pruebas y crear lugares más seguros a través de una mejor ventilación y distanciamiento. Muchas gracias para su apoyo. And with that, I will turn it over to Dr. Emily Landon.
Good afternoon. Make no mistake, Illinois, today is not the day to stop the mask mandate. And that's why it's not happening today. There are still way too many cases, but things are changing quickly. They're improving. Many have asked for a metric or a number that will guide the rules and regulations, but each wave of this pandemic has had different characteristics, different behavior, and no single metric has been able to reliably predict the outcomes and the trajectory of each of the variants. Smart physicians, scientists, epidemiologists, and public health officials are going to disagree about which metric to use and the exact date to repeal mandates and rules. This kind of discourse is good. It shows that we have a diverse community of experts that are considering all the angles. And the one thing that we all agree on is the need to aggressively respond to new threats on the horizon with precautionary measures. And then once our modelers and epidemiologists are able to reliably predict a trajectory, we have to begin then to shape a strategy for undoing some of those mitigations and mandates. Preparing to repeal statewide masking mandates at the end of the month is aggressive and optimistic, but it's also reasonable. This does not mean that no one needs to wear a mask anymore. It's an acknowledgement that cases have fallen to an acceptable or manageable level. Hospitals can handle the sick. Businesses are likely to be able to stay open. The cushion of immunity from just so many Omicron cases will help shield us from the exponential threat that is so threatening in the short term. Cases will still happen. Outbreaks will probably still happen. Of course, it helps to have everyone masked, but when cases are low, the likelihood of encountering someone with COVID is also low, making universal masking mandates less impactful. Broad mandates are not about individuals. They're put into place to help protect communities, businesses, healthcare access. But no matter when the mandates are repealed, we have to keep our eyes open for those new threats. The subvariant of Omicron BA.2 has been introduced to our community and is on the minds of a lot of people thinking about this, including me. It's more contagious than Omicron, but not materially different in terms of vaccine effectiveness or severity of illness. It has the potential to maybe slow down the trajectory of our recovery. But there is plenty of data from other places that are already battling BA2 that show that even as it replaces Omicron, the original, it's unlikely to change the overall trajectory forward. As with everything COVID-related, this could be proven wrong, and we'll need to make adjustments, as you've heard the governor and Dr. Ezike say today. I have advised countless people, businesses, organizations, and healthcare facilities about how to address COVID throughout this pandemic. And each one has endeavored to balance protecting health of patrons and employees with their bottom line and their goals. Repealing the mask mandate allows them to choose the mitigation layers that are best for them. And I have no doubt that many of them should and will keep masking rules. This is their prerogative. Including COVID risk assessments is just part of doing business now. Therefore, the mandate ending does not mean that you're entitled to be mask-free everywhere, anytime. If you're leaving isolation early, you have to wear a mask for 6 to 10 days. If you have symptoms of COVID, you need to wear a mask. Having choice also means having responsibility. Suffice it to say, this isn't an end to the pandemic, and it's not going back to normal, although I sure hope it feels better than the last couple of months. No matter how much we wish for it, hope for it, or demand it of COVID, this is a virus and it's ruled by biology. It doesn't negotiate with us or care about how we feel about it. We have to adjust to it, and we have to take advantage of the breaks that we get. We're headed into one of those breaks. I know there are some who will see these changes as some sort of confirmation that COVID really isn't that bad. I want to be clear. If you're someone who's had the luxury of being able to ignore the profound impact this disease has had on our country, our communities, our families, God bless you. But please open your eyes. Common colds don't kill almost 1 million Americans. The flu does not kill a parent of 1 in 500 children. If you find yourself sweeping away the news of a COVID-related death because that person had underlying medical conditions, ask your doctor what your chart says about you. A lot of us are carrying extra weight. Half of us have high blood pressure. 45% have some kind of heart disease or vascular disease. 10% have diabetes. 11 million now have long COVID, 440,000 in Illinois. And about 5% are immunocompromised, including me. It doesn't matter whether people die with COVID or of COVID, if they die because of COVID. There's good reason to still want to protect yourself and others from COVID. Immunocompromised people like me will still need to wear high-quality masks and take extra precautions. We're safer if we keep our distance from unmasked people and limit our social circles to vaccinated friends and family. It's not ideal, but it's the reality. With new medications becoming more available, and we have options for treatment that could help make up for some of the protection that we lose from the mask mandate. Many people are going to feel more vulnerable without the mask mandate in place. Families with kids too young to be vaccinated. Even healthy people who live with or have close contact with people who are higher risk. Elderly people, maybe all of us at one time or another. Please, be understanding and respectful when someone's wearing a mask or asks for a little space, doesn't want to attend an event, or wants you to make some sort of accommodation. And remember that places where sick or vulnerable people are congregating, like healthcare facilities, will need to keep masking. Crowded, enclosed spaces with poor ventilation, like public transport, are going to need to set a higher bar for removing the masking rules because the risk there is higher. And congregate settings where individuals can't really adequately advocate for themselves, like schools, are in this category too. I know everyone wants to see kids unmasked. I do too. But masks have made life livable for all of us. They've kept us out of lockdowns. They're keeping our kids in school right now. Masks in school have become so political that it's hard to imagine anyone thinking clearly about them, but the data is clear. Unmasked classrooms and counties without school mask mandates are more likely to go remote or suspend classes than those with masks. They have higher rates of infection in kids and in the community. While kids have low rates of risk on average, they live in social bubbles that include their parents and loved ones and their teachers, who may not be as low risk as the kids. And vaccination in children aged 5 to 11, while better here than in a lot of places, is still under 40%. And those under age 5 aren't protected at all. Like in healthcare, we need to have a higher bar for safety in schools because we need to keep them open. As the situation improves, we're going to meet that higher bar. It's not going to take very long. And until then, parents and guardians, this is your chance to get children who are eligible vaccinated. It will reduce their risk of getting COVID. It will also reduce their risk of severe illness or disability from COVID, and reduce the risk to your family and your loved ones. We have to take advantage of this well-deserved and needed break from COVID surge life. But the next variant will come, maybe in a few months, hopefully in a year. It will present new and different challenges, and we'll need a new custom mix of mitigations to address it. But we can't be so sick and tired of COVID that we think the comfort and denialism of not wearing a mask is more important than the life of someone's grandmother. I hope we can use this restorative phase for some real reflection about how to make peace with COVID. We can all use a little distance from the surging cases, the bad news, the disappointment, and the missed opportunities. Hopefully this time will allow us to be able to see COVID a little more clearly in the context of our future, because that will make the next wave easier on all of us. Thanks, everyone, and I'm going to turn it back to the governor to answer questions.
Thank you. Thanks, Dr. Landon. Happy to take questions, yes.
Despite all that's been said just now, and I'm not going to surprise you, there are people who are still questioning this decision and say, is it really about the science or is it about your reelection? On Monday, you said hospitalizations 3 times.
Yes.
Well, when you put the mask mandate in place, hospitalizations were at 1,700. We're not at 1,700.
No, we're not.
So why pick February 28th?
Because we're seeing a trajectory of those hospitalizations. We've come from 7,300, more than that, down to under 2,500 just in the last 4 weeks. And over the next couple of weeks, before we get to February 28th, I think we all expect to see a continuation of that trend.
Would you talk about those, the naysayers, or just your critics who believe this is more about a political campaign than about the science?
These are the same people that wanted us to take masks off or encourage people not to get vaccinated back when we had rising infections and rising hospitalizations. So it's hard to take them seriously at this point.
Governor, you said eventually masks in schools will go away. And
Yes.
In light of this good news today with hospitalizations going down and the fact that vaccinations are high for the Midwestern state, you still have 500,000 students right now who are in mask optional schools. Would you consider dropping the appeal and giving the power back to school districts? And are you surprised by so many parents and students who are fighting back, who are stuck in mask mandated schools?
It was an extremely bad decision by this judge. I mean, it's poorly written, it's poorly decided, and so we've got to appeal that decision because it takes away one of the tools that we have going forward. You heard Dr. Landon, Dr. Ezike in the past talk about we may see surges in the future. We want to be able to keep everybody safe in the future. And that case decided in one circuit court downstate in Sangamon County by one judge shouldn't keep us from trying to keep the entire state safe.
But are you going to put the toothpaste back in the tube? Because these kids are, I spoke to a teacher, a 3rd grade teacher today in Barrington District 220, who said, my 3rd grade kids are so happy and we get to see each other for the first time, in 3 years. So how you're going to take that away from them?
No, look, listen, I'm happy. Listen, I'm happy that kids would like to see this mask mandate go away. And I would like very much for it to be removed as soon as humanly possible, and I've told you that, and you've seen that we're making progress in that direction. But the truth is that we need to follow the advice of doctors, epidemiologists who understand this well, and nobody has wanted to wear masks all the way along. Perhaps you least of all. You've certainly made that clear all along. I think that we need to listen to the scientists about, and again, this is about community health, keeping communities safe. And that's why we've made the decisions that we've made all the way along in this process. It's about keeping communities and the entire state safe. And by the way, the metrics show that we have.
Governor, I noticed when you made the announcement, you said if this trend continues, sounds like you're leaving the door open for the possibility of not removing the mask.
Sorry, I couldn't tell who was asking the question because of the mask. Yeah, thank you. Craig, look, we're just, being realistic about this. I think you saw that Delta reached a peak back last fall, and it started to come down. And we all were very hopeful. And then you saw Omicron hit, and what was a declining number of hospitalizations all of a sudden turned around and turned into a much bigger surge than anybody expected. So we're just taking into account that we don't know if there's another variant out there. You heard about a subvariant that's out there. Again, I think doctors have taken that one into account. But again, the virus all along has been, mysterious in the direction that it's come, what variant has come at what time. We just want to take all that into account.
So put this on your calendar in pencil, not pen, is what you're saying?
I'm very optimistic, but I've been optimistic before.
Can you also just address the potential for the confusion or the problems it creates by saying that local communities, local businesses can still institute their own mask mandates?
Yeah, that's just the law. I mean, the law is that private businesses have always had the ability to put mask requirements in, to have different requirements, mitigations that they may choose. Same thing with organizations, same thing with cities and towns. They can always do something that's more stringent than what the state has required.
Governor, there's going to be those who are going to.
Can I just take a question over here? Sorry, I just so everybody gets a chance. Yeah. Yeah, sure. Sorry.
Doctor, you said that the end of the mask mandates is a step toward getting life back to before the pandemic, but you also said that we're learning to live with the virus, if I heard you correctly. These seem to be a bit in conflict. Can you talk about these two kind of phenomenon in conversation with one another, how we're taking the two steps at the same time?
Sure. So in 2019, before we knew who COVID was, we weren't wearing masks. So February 28th, if things continue in the direction that they have, we will go back to these public indoor spaces where there won't be a mask. So that looks like 2019. But does that mean that COVID is gone? No. So that there's a BC before COVID and after COVID. And so we are going to be in a point where we might have some people who are not wearing their masks, but that does not mean that COVID is not there. So there's definitely those two things happening at the same time.
I have a question to you, Governor. So when it comes to, you mentioned private businesses can still impose whatever restrictions, but what about municipalities? Does that stand for municipalities as well?
That is true, yes.
Okay, so Chicago, for instance, may not follow course.
They would, again, anything more stringent than what the state has laid out is possible for any municipality, including the city of Chicago.
And I realize with schools, everything is up in the air right now in the courts, but you mentioned in the coming weeks, we will look at. So what does coming weeks mean? Are we talking literally weeks or months? And I know Dr. Landon said everyone wants specific metrics, but yes, I'm asking what specific metrics might you be looking at when it comes to schools?
If you don't mind, I'm going to ask Dr. Landon to come, but I'll just say we really mean weeks. That's our belief at the moment. And again, it's, as somebody pointed out, it's with the hope that we don't see any reversal or a new variant. But it is our intention and our hope that that will be weeks. But
Governor,
Dr. Landon, do you mind?
Can you just clarify that, Governor, real quick? Because we're talking weeks, that could be the same time as the indoor mask mandate, if we're talking the end of February.
Well, I think our theory here is that because of the unusual environment schools are and present, that it would be longer than February 28th, but still within weeks. But if you wouldn't mind answering the previous.
Yeah, I'll just say that metrics are really tough for COVID. And it's great to have one simple metric. CDC recommends like a combination metric of sort of the number of cases and then the positivity rate. Now, both of those together are very useful. A lot of places have decided to go with those, but there are some arguments against it, that isn't really necessarily how sick people are, because that doesn't include hospitalizations, and that now that there's a lot of home tests, it may not be a good idea to choose just case rates, that the percent positivity could be influenced by how many people are being tested for asymptomatic for pre-procedure testing. There's a ton of minutia that goes into each of these things. So you have to kind of look at the trajectory of things, and you have to think about all those metrics together. When it comes to schools, I am not a pediatrician, but I will say that I think that it's probably reasonable. The guidance from the CDC is to really stick to those less than substantial transmission before you consider having anybody be unmasked in schools. I think you can be a little bit aggressive when you're talking about whole statewide mandates, because you can be more granular by letting people make their own decisions. But when it comes to schools, that can spill over into communities, and it can spill over into elderly people in hospitals pretty quickly. So it's kind of important to be a little bit more careful. Plus, kids are vulnerable and should be a little bit more protected. So I know it's difficult to understand, but I think it's going to be a combination of case rates. The hospitalizations need to be continuing to decrease. The BA2 needs to not really slow down the trajectory. We need to know that kids are not likely to spread it in schools and make schools be remote. We don't want nobody wants kids to be back in remote learning. I think that's the main goal here, is no one's going to turn it. Everyone's going to look at metrics that are going to help keep kids in school.
Dr. Langdon, you mentioned a study, and what study is it where you found that unmasked kids
Yeah,
in school?
there's a number.
There's
There's
more of a community spread than kids that were masked in school?
Yeah.
Did that take place in Illinois?
No, that's a state. There's some state data out of Minnesota. There's also there's a whole page on the CDC's website about masking in schools and why it's important. And it shows that in communities where there are not mask mandates, that there's more cases in kids, more cases in the community, and schools are more likely to end up going remote or having to be hybrid or doing these adaptive pauses. And I don't think anybody wants that for schools. And so it's important to be a little bit more careful, in my opinion, but it's their decision.
Governor, are you considering lifting the vaccine and testing mandates imposed through executive order, or are those along for the long haul?
Well, it depends on what you're talking about specifically, but I'll just say that for the moment that we want to make sure that we have teachers getting vaccinated and people getting tested who are in schools. We've provided more and more testing, made it available to schools. We want them to have it available even when the mask mandate comes off, because there will be certainly moments when having testing allows you a lot more freedom and not to have to go back to masks.
Governor, there are going to be those who are going to hear all this and they're going to say, all right, so it's okay for my grandma to go to the casino, for my uncle to go to the bar, for whomever to go to the Bulls game, but my kid can't go to school.
Yeah.
There's still going to be.
So remember the difference between that. We have kids going to school for 6 to 8 hours, 5 days a week, week after week after week. That's very different than someone going to a bar even for 2 hours or going to a ball game. And so I would just say, look, I'm sure that everybody's going to point to some particular circumstance that happens on one day or even a couple days in a row. But the reality is schools are quite unusual. Thousands of people often are interacting with a school, certainly hundreds, if not thousands, in a single day and every day. And that's very different. And so we're trying to take that into account while also moving toward removing mask mandate if we can, and I believe we will. This young lady back here, sorry. What's your name? Casey, thank you.
If all goes accordingly and the statewide mandate is lifted on February 28th, should residents be prepared, though, that it may be reinstated in the coming months after that?
Well, I don't think that you need to be with some heightened preparedness for any given day. I mean, I think we can all see the numbers. They do get published often in your publications, what direction these things are going. And certainly we're going to be alerting you when we see signs that things are going the wrong direction. I do think that people are going to need to to keep a mask with them, even if they're not wearing it, because as was pointed out, there are rules, federal rules, about getting onto mass transit, for example. even if you don't want to wear a mask when you're walking around in your town, your city, when you get on the bus, you're going to need to put on the mask. And so you're going to have it with you.
So depending on how numbers are, the 28th doesn't necessarily mark the end of the statewide mandate. It could potentially be reinstated.
No, it's the end of the statewide mask mandate, but as we've all said, if things get very bad, I think we've seen this before, with the onslaught of Delta and then Omicron. Boy, masks really helped us to keep infection rates, transmission rates down. So there may become a time in the future when that happens. You may remember that last summer, in May, in spring, we announced that on June 11th, I think, that we would move into phase 5, that people could take their masks off, and they did. And we were, I don't know, about 3 months where people weren't wearing masks, and I think all of us very hopeful that we might be able to never put masks back on, right? But as we saw, things started to rise, and it was a good thing that in Illinois we were maybe ahead of others to say, okay, everybody, heightened alert, time to put masks back on. And yeah, there may come a time in the future when we need to do that.
Governor, at this point, your administration has really followed CDC guidelines very closely. Under the current guidelines, transmission is still considered high in all of Illinois. I guess why the decision to be more aggressive than the CDC at this point?
So 2 things, just to remind you that there was I've been in office for 3 years. The CDC was under different management just a year plus ago. So not always. We've had to sometimes fight the CDC. But in this case, we're following the numbers that the CDC is putting out and recognizing that we're not there yet. And that's why February 28th is a goal. It's not today. We're announcing it today, so people will know, businesses will know, when that date is coming. Our trajectory looks like we're going to be somewhere close to maybe where we were last summer, or at least in May when we were making the decision back last May. And my expectation is that, we'll continue to watch what the CDC and listen to what the CDC is saying. But we do think, and I think, again, collectively, and I've talked to other epidemiologists not in the room and people who are infection control specialists, people really do feel that the trajectory here is one that we're going to be able to hold on to.
Governor Pritzker, are you doing this on the 28th because the State of the Union with President Biden is going to be delivered the following day, March 1st?
No.
How often do you talk though to other governors, especially other Democratic governors who've made similar decisions this week?
Well, I talk to governors all the time about this, and I haven't talked to a specific governor in one of the states that announced it this week anytime in the last week or so. But we, look, all of us are challenged in our states, slightly different circumstances in each state. I think you saw that, I think the Northeast got hit with Omicron before we did, and then it seems like almost like a cloud moving east to west. It seemed like it came to the Midwest and it alleviated in the East before it alleviated in the Midwest. So, it's hard to say that, talking to one or another governor is going to tell you a timing question. It's more, the advice that we seek from one another, governors, is how did you handle this type of circumstance when it came up? I remember, for example, that I called the governor of New York couple of months ago. This is the current governor of New York, when she put in place a limitation on elective surgeries. You may recall that. And other states were not doing that. And so I was, she announced it. There really wasn't a great explanation in the news. So I called her to say, can you just tell me what's going on in your state? And she gave me some advice about what was happening in her state, not relevant to our state at the time, so not something that we needed to do.
We'll do one more.
Yes, sir.
What kind of data are we looking forward to getting epidemiologically once the masks come up? I mean, I imagine states that never had mask mandates, we're getting data from that. But as far as, maybe this is a question for Dr. Ezike, what, about case transmission rates, et cetera, what's there to learn from this kind of experiment, scientifically, once it happens, I guess, more of a science question than a policy question, I'm interested.
No, I'm glad that you used the word experiment, because I think people might be uncomfortable with that. We are forming the experiment in the real time and learning from it and making decisions based on it. So when we think about any kinds of changes, you really, and that's just a general scientific principle, you don't want to try to be looking at the results of too many changes at the same time, because when the results occur, you're not sure which intervention can you attribute it to. So for instance, now we're taking the big step, hopefully on February 28th, to have the indoor mask mandate for the public spaces suspended. We need some time to make sure that we don't see some kind of unexpected result. So we don't want to take it off in all settings. We can start there and look at it and see what's the result of doing that. And then you can say, okay, we've assessed the result of that intervention. Now we can move to another intervention. Doing two things at once can confound the results and not make it clear which intervention had what result. And so really stepwise moves make sense and allow you to actually evaluate what you've done.
I'm sorry, if I may just add, Doctor, I think, each time that we've had a variant, you're in a new set of, you use the word experiments, but as you know, Omicron was vastly different than Alpha. And so all of a sudden, and you don't know, nobody hands you the playbook on the new variant, you have to watch it. And one of the things that happened with Omicron was, I think we all saw that it hit South Africa, it hit Scotland and UK, and we were able to see that when it peaked, it came down at a rapid rate. That was informative, not necessarily what was going to happen in the United States with Omicron, because there's a subvariant. But you're trying to address these things as best you can when they come forward. And again, each one of these is a bit different.
All right. Thanks, everyone.
Thank you.
Thank you.